the common iliac.
And then the pelvic splanchnics, which is which nerves? S2, 3, 4, and again, it's lateral horn.
Eastern Virginia Medical School was founded by the community in the 1960s to meet the healthcare needs of Hampton Roads.
Good, that's what I want to see.
In the beginning, that meant training more doctors. But the healthcare landscape is changing, and we need health professionals in a wide variety of areas to keep our community healthy.
Yep, just wiggle it.
I knew since I was a little kid I was interested in medicine.
And I wanted to be able to make an impact that was long-lasting.
So we want blood to go this way. If it goes back up where it came from, we got a problem.
I was originally interested in public health through my mother.
I actually ended up working in a basic science lab and doing bench work like this, and I loved it.
Being a part of surgery is very important to me, knowing that I'd be able to improve on people's lives.
I had such a passion in the arts, but I was pursuing the science instead. So I wanted to see if I could merge those two together.
And I want to be that person to help people get better.
And that's where that stone gets that first blockage.
So hold it up here and then let's...
Over the past few years, the evms School of Health Professions has been growing significantly.
And now we can see the arch of the aorta.
And you're going into a profession that I think will grow in importance in the future.
And so they sort of hug the artery.
We train students to become PAs, surgical assistants, art therapists and counselors, biomedical scientists, and the list goes on.
We have really grown at EVMS over the past decade. That's a remarkable thing for an institution to become a small academic health center.
We are always looking at future healthcare needs to see how we can use our resources to train professionals to meet them.
Thanks.
EVMS focuses on graduate education in medicine and the health professions. Some of our programs are necessarily residential, like our clinical programs in physician assisting, surgical assisting. Other programs lend themselves very well to either a blended approach to online education or totally online education.
My favorite part about the program is definitely that it's set at my own pace. It really works with my schedule, and it's been pretty flexible.
So we have invested pretty heavily in our faculty and in our technology to support online education as a growing venue for entry into the health professions.
What I love about being at EVMS is the fact that we are at a medical school. You can see how the bench work that you're doing, it can translate over to the clinic.
You come up with an idea that nobody's ever tried before, and you get a chance to make a difference with that idea.
I think my favorite thing about EVMS is they talk about community impact and really having a close-knit community, and they do walk the walk here.
Well, anytime you give back to the community or do something for someone else, it's uplifting. I mean, life's not about what you take, it's what you give.
The reason you go into a health career is to help people and help make communities better able to support individuals.